Hello, everyone. Hello. Hello. Thank you for joining me, or should I say joining us for this webinar. Today's topic is going to be of injuries. Actually, we're going to be talking about hard dental tissue injuries. I will not be going to other stuff. I will not be talking about other injuries. I will be talking only about hard dental tissue injuries because this is a topic that is, large enough to cover many things. We will cover also some of the materials, and that will be about it. That's actually the plan. So let me introduce myself. My name is Miloš Beloica, and I am a dentist from Belgrade. I work at Clinic for Pediatric and Preventive Dentistry in Belgrade, actually University of Belgrade at Dental School of Medicine. My specialty is preventive and pediatric dentistry. And also, why did I choose this topic? I chose this topic because I think it's quite interesting that a lot of people ask me about this topic. And basically, it's something that everyone should know, that everyone should be acquainted with. And it's something that is of interest for everyone, basically. So, izvinite, Mirela, sorry, I have to translate to Serbian just for a moment. Mirela, nažalost, ovaj webinar je na engleskom jeziku, pošto je publika internacionalna, tako da nema prevoda na srpski, biće samo na engleskom. Sorry, I had to explain that there will be no translation to Serbian. There will be only speaking in English, so the whole webinar will be in English. Like the previous webinars that company KaVo organized, this webinar will be conducted in such a way that it will be recorded, and you will get the link afterwards where you can go to the recording and listen to it, or go through slides or whatever you want. So you will basically be able to go to the recording of the webinar. So if you would all agree, I would like to start this webinar. So as I said, today's topic is hard dental tissue injuries. Basically, when we talk about injuries, any injuries actually, and any talk of injuries consists of etiology, therapy, and prevention. Those three things have to be spoken about together, and basically it's because we need to know how the injuries occur, why did they occur, why certain age of our patients have more injuries than maybe someone else, what is the therapy, how we should do what we're supposed to do, what are we supposed to do, and also prevention. Unfortunately, since the prevention is one of the main topics, let's say, during this conversation about injuries, I will not, and since it's so large, I will not be talking about prevention. I will only tell a small portion of it just to remind you that there is prevention, but we will not talk about it right now, because right now we will concentrate on etiology and therapy, actually on materials we can use in our everyday practice. So what can get injured when people fall down, when they get into a fight, or when an accident happened? Basically, what may get injured is teeth, alveolar ridge, or soft tissue. These things basically can get hurt, by itself, or they can make a combination. At our clinic at University of Belgrade, what mostly happens is that we get patients, children actually as a patient, and these patients have combined injuries, usually is teeth with soft tissue, sometimes with alveolar ridge, but it's not so complicated when they come, because usually it doesn't involve alveolar ridge. So basically, our specialty is one of the specialties that consists of basically repairing all the damage that has happened. So teeth injuries are a problem because they represent instant disharmony of teeth and mouth, so complete oral cavity. This is actually what happens, and it happens even if you start with infraction, or even if it starts with contusion of a tooth, but basically it can go up to tooth loss, and that's something that we want to avoid. In everyday practice, we try to make everything possible and to do everything that is possible in order to save the teeth. So as soon as the injury occurs, we're supposed to do something. We're supposed to give first aid in order to save those teeth. The problem is that the treatment is almost always long and always is questionable. Why is it so? It is so because the problem that persists is that even when you have a contusion, or if you have an infraction, what happens is that they seem okay at the beginning, but later on complications may start. And if these complications start, then we have a problem that these teeth may actually suffer many things. Actually, many complications can derive from that state, and finally the tooth or teeth may be lost. In Serbia, as well as other countries, because these are actually the results that they're completely in order or in line with other research that has happened in other countries. Boys get hurt almost twice as much as girls. This can be explained by their temper. This may be explained by being in sports, being aggressive. So these are actually the things that happen. What usually get hurt, usually upper incisors get hurt. And where does it happen? It happens depending on the age in different places, or from different reasons. Basically, what this says, this chart that you're looking at, what it says that in the age 1 to 3, and also in the age 4 to 6, so basically from 1 to 6 years of age, injuries most often occur in playgrounds or something like that, and they happen by accident. Why is it so? It is basically because from 1 to 3, children start to walk around. They're trying to walk. They usually fall, and when they fall, they can get injured. From 4 to 6, they start to do some sports, but still it's mainly by accident. From the age of 7 until 12, you can see the change, and the change is that it does happen still by accident, but sports and playing and other things come into mind. And also from 13 till 19, the whole thing changes because the violence starts to kick in. You can see that 20%, actually more than 20% of teenagers get hurt in violence. So this is not a good thing. This is something that the statistics shows, and it's similar in other countries as well. Where does it happen? Again, it happens at home, outside of the house, at some other things. here on the bigger one, you can see a bigger pie chart. You can see actually that 50% get hurt outside of the house. When you take that percentage, you can see here that usually it happens in the street, it happens at the sport gym, swimming pool, or whatever. Also in the playground, park, yard, and similar things. So basically, it's similar in all the countries, and we have to take care of the children, and we have to take care of certain things. Why was this important that I was talking about? It is important because we as dentists and as health professionals, we cannot save everything. The point is to spread the information, and the point is to involve almost everyone we can. Why is it so important? Because we can involve teachers, we can involve, kindergarten teachers, we can involve people who actually train those kids to be athletes, or whomever, because these are the people that actually have the first contact when the injury occurs. It's up to them basically to know what they're supposed to do in order to save those teeth. Because if an injury occurs and if there is a fragment of the tooth inside of the gym, but if the trainer doesn't know that, or a teacher doesn't know that they're supposed to take that part of the tooth and send it with the child to the dentist, then we cannot use it. We have to have a different approach or a different type of therapy, which is not a good thing. So it's much better to entertain and to basically educate those people so they can help us. In this way, we can all help our children and help the people that get hurt in a better way. That's the whole point. So in order to know the etiology of injuries, we have to consider certain factors that are related to oral cavity or to space or the object that actually makes the injury or whatever. So factors that are related to oral cavity are mostly orthodontic anomalies. These orthodontic anomalies can be open bite, protrusion of the upper front, which is basically one of the things that is mostly talked about. Crowding as well. Hypoplasia, caries, and large teeth reconstructions. Why is it so? Because orthodontic anomalies like open bite or protrusion of the upper front are the things that mostly influence the type of injury. You will see on the next slide why I say so. Hypoplasia also, it weakens the tooth. So if the tooth is weakened when trauma happens, usually what may happen is that these kind of teeth get broken. So we have to be careful about those teeth. Caries also weakens the tooth. Large teeth reconstructions also weaken the tooth. So it's much easier to have severe injury when you have things like this inside of the patient's mouth. If teeth are healthy, then it's much more difficult to basically get more injured than when you have things like this inside of the mouth. Sorry, I have to translate again in Serbian. Pozdravi vama, zaista hvala puno što me slušate i nadam se skorašnjem viđenju. I hvala Tanja prošli put za pomoć, zaista, divna si. Sorry, so let's go back to English. What is the risk? Why did I say protrusion? Okay, so when you have deep bite, when you have upper front protrusion, or when you have shorter upper lip, basically what happens is that the lips are not closed all the time, so they're not touching. So you can see how the teeth are basically wide open. When a child that has this type of problem falls down, what is the first thing that they will hit? Of course, the teeth. So in these cases, protrusion is the problem and is the main issue when the injury happens. It depends, of course, on the object, and it depends, of course, on the speed and other things to know what type of injury might happen and what type of injury may happen. So the factors that influence the type of injury: first, object hardness. If you have a rock or if you have the wood, the injury will not be the same, okay? Because if you have the rock, when the rock hits the tooth, what will happen? The fracture will occur, of course. The smaller the object, the bigger the speed, the more fracture will happen. Then again, if you have something that is resilient, like the wood, for example, when certain people, actually when kids or people get hit by a tree or hit into the tree, since it's resilient, then maybe fracture will not occur. But what may happen is that you know, the surrounding tissue will get hurt instead of the teeth. That is really important in order to know what type of injury will occur and why did it occur in such a way. The speed is also one of the really, really important issues. The bigger the speed and the smaller the object, like I said just a moment ago, fracture will occur. This is the way actually that multiple fractures occur mostly. And if you have a rock that is in full speed, yeah, then you will have a bigger injury. If you have something, again, like the wood and, you know, slow movement, then you will have more of the soft tissue and surrounding tissue around the tooth injured instead of the fracture of the tooth. Also, what influences is the force direction. The force direction may differ basically in a way that many things move around, many things may hit the people. So basically, what is most important is that the most common force direction is the direct, actually intraoral movement. Why is it so? Because the easiest way to get injured is when you fall down directly or when you get hit directly by something. So it's the force that is most commonly used in any type of injury. This kind of force may cause trauma in a way that the teeth may get fractured, or in a way that they might get luxated, or, you know, contusion may occur, or whatever the injury is at the time. But basically, everyone should know that most common is intraoral direction. Since I have spoken about all these things, now we can understand that there are certain risk groups, and these risk groups are actually divided according to age and gender. Basically, age, as we spoke about, you know, from 1 to 3 is really high risk, because there is a risk of falling down, since they're starting to walk around, they're starting to you know, learn about things, and they're really curious. The older they get, the space where they get injured changes. The terrible thing is, like we said, the teenagers start to get hurt in violence. So this is not a good thing. So basically, it would be better to get hurt by accident than in violence. But what can you do? It's something that comes with the age. Also, the gender, like I spoke about, the males get much more injured than females. Again, it's the temper, it's sports. Athletes get injured quite a lot. I don't know if you know, but basically, according to certain groups and according to certain regularities, there is no safe sport anymore. So all the sports are considered risky. It just depends if it's medium or high risk. So there is no sport anymore that is like low risk or something like that. The next thing I have to say is that we have to talk about classification of hard dental tissue injuries. Faculty of Dental School of Medicine in Belgrade gets its classification from information and classification from International Book of Diseases, so-called. So it's something that is used most commonly in all the countries. In this way, we can basically compare our results with the results of other people in other countries. In this way, we can say that if you break enamel, it is fracture of class 1. If we break enamel and dentin, then we have fracture of class 2. Enamel, dentin, and exposed pulp is class 3. And of course, there is class 4 if the root gets broken. The classification of the root injury also has some subgroups, and these subgroups are in such a way that they're according to the height of the injury that has occurred inside of the root. So basically, they can be cervical, they can be in mid-range, or they can be in apical part of the root. Still, it's all class 4, but just for you to know, there is a difference in the possibility of treatment, and there is also a difference in classification in line of where the injury happens. The important thing is to know the procedure. The procedure around patients with teeth injuries is that we have to treat them as an emergency. This is really important because they have to be, the injury has to be recognized as an emergency. It doesn't matter if the age is, 6 months or 18 years of age, it's still an emergency, and it needs to be recovered, and it needs to be treated as so. The way we start is that we take anamnesis, which is, it's really important to know what has happened, how it happened, so we can treat the patient in the best possible way. Then clinical examination, which is really important in order, again, to know what we are supposed to do. When we finish the clinical examination, we can actually derive from everything we know, diagnosis, and then make a therapy plan. The therapy plan is, of course, individual for every patient because all of the injuries are different, and you cannot have something set up for everyone. Basically, it's up to the injury, it's up to the doctor that is supposed to give first aid and everything to decide in which way it is the best to help the patient, and it is the best way to treat that trauma. So what is important? It is important, since I'm from PEDS, I have to say this. This part of treatment basically is supposed to be taken from parents or their patient's escort, whoever that is. Because if you get a child that is, let's say, 6 years of age, you cannot take everything that they say like it's true. Sometimes they might say something that is not completely true. So you have to know from someone who is an adult. So basically, you have to take this from parents or patient's escort. The point is that it is really important to get the right information from the patient or parents or their escort, because it is mandatory that you have trauma chart. If you don't have trauma chart, then if there is judicial expertise, then you cannot answer all the questions like you're supposed to, and it's kind of a problem. So it's really important to write down all the information that we get. You have to ask, when did the injury occur? It's important because in order to know how much time has passed, you will make a decision what to do with the patient, what to do with those teeth. Where did the injury occur? It's really important because sometimes with head injury, actually mostly with head injury, and if the injury occurred outside of the house, let's say, you have to prescribe antibiotics. So it's really important to know where did it happen, how did it occur. It's really important because if it's violence, then you need to report it. You need to report it to the police. You need to report it to someone. Also, what is really important, since we're talking about the children, it's abuse. Because if injury happens as an abuse, it's really important to, you know, alarm certain people so that children or women or whomever it is get protected. So it's really important to, you know, ask the right questions and to write down the answers. Why is it so important? Again, it is important because of judicial expertise, because later on you might be called to a courthouse and you might be called to answer, why did you write such things down? So what is also important? Did anyone provide first aid? It's really important, because if someone did something before you got to the patient, then you need to know what they did, and you need to know in what way to continue the therapy. Have these teeth been injured before? Also, it's important, because if the injury is occurring several times, then you know that the prognosis of the therapy that you do is, you know, really, really questionable. Is there any subjective interference? This is really important to know, because you need to know if your patient feels pain, or if it's, you know, unable to close their mouth, or if it's unable to bite. Because if they are unable to bite, then you need to do something really quickly. If they cannot close their mouth, maybe it's because of the tooth, or maybe something else is broken, and maybe you should consider sending them to, you know, surgeon or maxillofacial surgeon or whomever. So maybe you need help from a different specialty in order to provide the good care. Are there any consequences from the injury? This is really important, because sometimes, like amnesia or disorientation in time or place, you know, unconsciousness, sickness, maybe the patient was vomiting, you don't know. So if any of these things happen, you need to know this, because maybe it's a good thing to, you know, not to give first aid, but to send the patient first to the neurologist, who will check everything, you know, in ER or whatever, and then to send the patient back to you to save the teeth, because sometimes injuries of the head or some other injuries are basically more important than the teeth. So we need to take care of the whole patient, not only of the oral cavity, so not only the mouth. We need to be really, really careful about this, because it's not important to save the teeth if you're gonna do something that is not good for the patient, you know, for their basically in order not to affect their life in a negative way. That's something that we should all be careful about. Clinical examination starts with soft tissue. Basically, what happens is that you look at the patient as soon as they come to the office. We are all trained to look at the way they walk, look if they need any help walking, or they can walk by themselves, the way they sit down in our dental chair, dental unit. And we need to see this, because this way we can actually see if there is an issue with their legs, if there is issue with their arms. So we need to look at the whole body before they actually get into the dental unit. What we need to look at the face. We need to look at the protruding parts of the face and jaws. Why is it so? Because some fractures may happen and we might not see them. Sometimes we're the first people that see the injury, so we need to know what we're looking at. After we look at the soft tissue and after we look at the protruding parts of face and jaws, then we look at the teeth. If we see the injury on one tooth or, you know, several teeth, then we need to also ask for an X-ray. X-ray is something that is mandatory in these cases because we need to see what type of injury happened. Sometimes it happens that on X-ray you see more things than you actually saw inside of the mouth. Sometimes it happens that you see some things on X-ray that may not be true, but still you need to make an X-ray to Sorry for that. I got lost at the moment. Could you tell me at which place did we lose the presentation? Because 2 last minutes. Okay. Let me start it up again. Sorry for this. Something is wrong with the connection, and there has been issues. Hopefully, this will be the last time. Okay, so mandatory X-ray. Okay, thank you. Thank you. So this is the slide. Okay, so you can see it again. Now it's okay. Thank you. Okay, so mandatory X-ray in order to get all of the information that we're supposed to get. So basically, it's really important to get an X-ray in order to know what is the type of treatment that the patient needs. Sometimes the X-ray may help a lot. Sometimes it may show certain things that we were, hoping not to see, but still we're supposed to make an X-ray in order to know the right therapy. So the teeth examination starts with the tooth mobility. It's something that we need to check. It's really important to check the tooth mobility because if it's moving a lot, then it will show us in which way we should go. If there is supposed to be immobilization of the tooth, or if we're supposed to, if we're not supposed to immobilize the teeth. I like to start this test by, trying to move not the one that is injured, but the teeth around it, because in this way I try to basically avoid additional trauma of the patient, because when we talk about children and when we talk about patients that come after trauma, these people come in pain, and we're not supposed to make additional pain. We're supposed to do something to help them. So let's be human. Let's try to do something to make them feel a bit comfortable, if it's okay to say something like that. I don't know how comfortable anyone can be when they get injured, but basically let's try to do something like this. So basically mobility, then percussion tenderness. It's something that we should try, and we have to try it. Unfortunately, sometimes it is painful, but we have to try it because we have to know what we're supposed to do. We're supposed to look at the fracture surface. Why is it so? Because we need to see if the pulp chamber is open or not. We need to check vitality. This is the really important part. When we check the vitality of the tooth, it's important to know that for some time after the injury, we're not supposed to care about the vitality. It is because the pulp is in the state of shock. And when the pulp is in the state of shock, it will not react as it's supposed to. So it's not going to react completely in the same manner that the healthy pulp reacts. So basically, let's say a month after the injury, it might not show that it's vital, but that's quite okay. X-ray, of course, we need to make an X-ray of the teeth. We're supposed to make a decision which type of X-ray, and the decision on which type of X-ray we will make. It's up to us. Basically, made on what type of injury the patient has. And of course, we need to make systematic examination, because it's not solely to look at the teeth that are broken. It's not solely to look at the teeth that are injured. So we need to look at the whole mouth. Why is it so? Because sometimes when you need to put, let's say, immobilization, it's really important to know which teeth you may use. Because if you have the serious teeth inside of the mouth, and they're about to change, you cannot put immobilization on them because they're already wobbly. So basically, you need to look at the whole mouth so you can make your treatment plan according to the patient. So individual treatment plan is something that really needs to happen. These are some of the cases just for you to see. So sometimes it doesn't look that complicated. Sometimes it looks fairly easy. But then again, as you can see on the X-ray, sometimes when you have something that looks really easy for therapy inside of the mouth, when you make an X-ray, it isn't so, because here you can see a complicated fracture that goes all the way through the crown to the root. So this is basically the tooth that will probably get extracted when you start the therapy, because at the time that you're starting to treat the trauma, you have to have an X-ray. With this tooth, you need to make a plan. The plan is probably to extract the wobbly part and to see what's going to happen. So is the pulp chamber open or not? You don't know, but basically you will see when you take that part out. X-ray in traumatology is something that is mandatory. So what do we take X-rays of? Teeth fracture, alveolar ridge fracture. Root development stage is really, really important when we talk about pediatrics, because we need to know if the stage of the root development is complete or not. Also, the surrounding tissue, the pulp, is it exposed or not? And if there is any infection, because sometimes the complication of the trauma may be shown on X-ray images. So it is something that we need to take care of. It needs to be taken care of. It needs to be looked at. Here again, you can see the same image, and you can see actually the photo of the patient that got injured. So this is the photo and the X-ray of the patient that I was talking about previously. You can see the upper image, you can see the lower image. On lower image, it's much more clear what has happened. So on the upper image X-ray, you cannot see completely what has happened, but on the lower one, you can see that this tooth is unfortunately for extraction. It cannot be saved, even though, as you can see inside of the mouth, this child is basically around 7 years of age. Still, it's the patient is supposed to lose this tooth. It cannot be saved, and you have to have some other way to do the therapy. Complicated fractures are always complicated. So basically, you need to know how complicated it is, because even though you're supposed to extract the tooth, you need to know how many parts there are. You need to know the stage development of the root. You need to know what type of instruments you need in order to do the extraction. And basically, afterwards, I mean, when you do the extraction and when you finish everything, you're supposed to check if you took out all the parts. If you cannot set up the tooth the way it's supposed to be, then you need to make an additional X-ray in order to be safe that you have extracted all of the parts of the tooth. It is really important. If you cannot find the fragment of the tooth, it is really important to check where it might be. So this is actually the image of a patient that had a fracture of class 2, so enamel dentin, and we were unable to find a part of the tooth, so the fragment was missing. But then again, inside of the lip, he had, you know, certain scar tissue. Actually, it's not scar tissue, sorry. He had a wound. So we looked at the wound, and it was really strange looking. It was like there was something hard inside of it. So this is the X-ray of the lip, basically. And inside of the lip, there was fragment of the tooth. So this is also one more thing that we need to be careful of. That's why we need to have systematic approach, and we need to check everything. So it's not only to look at certain things. Sometimes, unfortunately, X-ray images may show us something that is not there, and we have to be aware of this as well, because according to the angle that is made during the imaging, basically we may see something that is not there. As you can see on the upper part, the upper image, there are certain angles. So according to the angle of the fracture, sometimes you can see something like several fracture lines, even though they're not there. So in these types of cases, basically you either make several images just to be safe, or what may be used now, we have Cbct. So it's something that we may use in these types of cases, because if we want to be certain of the injury that happened, we can basically use Cbct. This is actually one of the cases like that. I looked at this patient, let's say, I don't know, 2 months, maybe 3 months ago. And this is a kid that is 10 or 11. I cannot remember right now. But the problem was that his mom brought the X-ray image that I looked at, and there was nothing to see. Everything seemed normal. He complained of pains. He went to several dentists, and they looked at his teeth, and everything seemed to be in order. I used the probe, and I started to touch his tooth. It was number 14, 1-4. So upper right, first premolar. Everything seemed to be in order, but then again, one of the sides started to move. Since the X-ray didn't show anything, I wanted to see Cbct, so I sent them to make such an image. And when they came, as you can see here, actually it was fracture all the way. This tooth needed to be extracted, so there was no help for this tooth. But the strange thing is that it couldn't be seen on X-ray image, and somehow it wasn't clear inside of the mouth. So we need to be careful, and we need to make X-ray images. If one X-ray image doesn't help, we can make additional one. basically, it's something that we need to do, and it's something that we need to cover. Okay, so talking about the therapy, now we're supposed to go to therapy. Let's start from the smallest injury that may happen on hard dental tissue. So infraction of the teeth. Infraction is something that is rare. Actually, it's not rare. It's quite common. But the problem is that when infraction happens, usually people don't go to the dentist because, it doesn't hurt. You cannot see it always. Sometimes you need to put, like a lamp, or in certain cases you can see what has happened. The thing is, these are actually fractures inside of the enamel, so they don't go further than that. They will not do anything to the tooth because basically the bacteria will not go further inside of the tooth. Is therapy needed? Yeah, some of the therapy is needed. I mean, it depends on who you ask, but basically what you can do, you can put fluorides, so you can apply fluorides, or you may apply certain pastes such as tooth mousse, for example, or something like that. And this is the therapy, all that is needed. The infraction is not together with some other injuries, then it is quite possible that the complication will not happen. Still, you don't know. Do we need to do a checkup after the infraction? Some people say no, but basically, since we're talking about children again, because I'm in peds, then yeah, we should do a checkup after a while, just to be safe that everything is normal. Therapy in something else, when fracture exists or when fracture happens, is different, because we need to use composites in hard dental tissue injuries. Basically, we're supposed to make the part functional and aesthetically available like it was before. We can only do this by using composites. And what we can do is we can join the fragments, we can glue them together, we can do a composite buildup. And there is an issue with endodontically treated teeth. Why is it an issue? Because there is something that is called Farrell effect, and this may influence the therapy in a really important way. So we need to know about this. So this is a case that I actually did. I was really, really proud of what I achieved when I did it, and this was I don't know, I think 10 years ago. I was really trying to make the morphology of the tooth, to be perfect, but I used the composite that I had at that time, and as you can see on both images, the problem is the shade. The shade basically is okay because it is the same shade of the other teeth. The problem is that the whole crown is composite resin. And the problem is that the material that I was using was too transparent. So what happens is that it's not actually dark, but the darkness inside the mouth goes through goes through the material, and that's why it seems this way. This is something that we all want to avoid. We don't want to. So she wore this for additional 2 years, and then basically she got a crown and everything. I'm really sorry for this again. Now I saw what happened, so sorry. hopefully that's happening, because otherwise it will take too long to finish the lecture. I'm sorry, I have an issue with starting the presentation, so you can see the presentation. I'm so sorry for this. Yeah, I'm trying. Okay, so like I said, this is something that we want to avoid. So basically, I'm going to go through the therapy methods that we can actually use in this type of cases. So we can join the fragments, actually glue them together, and we have several things that we can do in this way. So one of the things is to glue them together, as you can see here in A, and make kind of a bevel outside, so we can make possibly better aesthetics. The problem is the material itself, because when we do something like this, what may happen is that the material might be so transparent that it doesn't look so good. Another option, as you can see in B, is to make V-shape inside of enamel. This is really difficult to make because in order to make such a V-shape, you need to be really careful not to touch anything else. And also the transparency is an issue again. Third option is the part in indenting. We need to know basically when we do something like this, how close the pulp chamber is, not to open the pulp. Also, it's not really something that makes the retention so great. So this is not something that is usually done. As you can see in D, again, it's beveling. Again, the problem is transparency of the material. E, you can actually bevel when you glue together the fragment and the tooth. You can bevel all the way and then basically do something that may look better. And F is actually something that we do most commonly in everyday practice when we have the chance to stick together the fragment and the tooth, because they need to be intimate. When I say they need to be intimate, it means that you take the fragment and then you put it back on the tooth. And if there is no space that varies, then you can do procedure like this. So it can be done in deciduous teeth. It can be done in permanent teeth. It doesn't matter of the dentition. It's important of the way how you do it. So basically what you need to do is to put acid to etch basically both of the parts of the tooth, then use bond adhesive material, you need not to cure the adhesive material at this point, because if you do, you will ruin the intimacy in between the fragment and the tooth. So basically what you do is you apply the adhesive material, and then you apply small portion of flowable composite resin, and then stick together these fragments. What happens next is that you light cure only then, because if you light cure before, it will not stay the way it's supposed to be. So this is one of the cases that we did. It's not, it's really good looking. It's something that you do really easily. The whole procedure is done in let's say 15 minutes. So it's the best way to save the tooth. This procedure can be done even if you have an open pulp chamber, so it doesn't matter. I mean, you can do the endodontics, you can do the endo treatment, and then afterwards you can join the fragments together. It's just a matter of the way you do it. As you can see on X-ray images, actually the endo that was done previously, it wasn't okay, so the endo needed to be done again. When it was okay, then a small part of the fragment was removed, as you can see in dentin. So we would be able to put the composite material inside of the tooth. Then again, small portion of the material inside of the crown was removed in order to obtain basically the retention, because we didn't want to use the post at this point because the fragment was too small, but still we wanted to use the fragment since we had it. So acid etching technique, then applying the adhesive system, applying the flowable resin composite, applying the fragment, and you can see the end result. So it's quite okay, and it's quite easy to get a good result in a way like this. If they don't bring the fragment, if they just come with broken teeth, then you need to do something else, and that something else basically is composite buildup. So when you have only enamel broken, it's really easy to use the composite material and to finish everything quite fast. So basically, instead of giving first aid, you can basically make perfect restoration immediately. Small portion of universal composite resin or flowable composite resin, and you can finish everything. It's not difficult to treat the class 1. Plus, the class 1 is only in enamel, so possibility of complication is really small, and we need to know this. So basically, the best way would be to finish as soon as possible. When you have broken enamel and dentin, then you might have a problem, because in this way, if the injury is too severe to do everything at once, actually to do everything in the beginning, then we're supposed to give first aid, and afterwards, you know, like 7 to 10 days afterwards, we can do the restoration completely. Here you can see that both teeth were broken. The material that was used in this case is harmonized. It's Kerr's latest composite resin, and I have to say it's really nice. It gives a real glossy effect and everything else. So total edge technique. Also, I have to say that in this case, I was using OptiBond Universal because I liked universal adhesive systems, but I wanted to use something you know, contemporary. So putting the material, light curing, and then putting the composite material on the tooth. As you can see, I did it freehand. I like to do build-ups freehand. Of course, switching the materials, because I used dentin shade and then enamel shade. Afterwards, of course, using discs, you know, to get that perfect gloss and good look. And this is actually the end, from the beginning to the end. This is the photo 2 weeks after the injury. And as you can see, the fragments, actually the buildups and the teeth are the same way. So this is the second case, again, enamel and dentin. 2 teeth are broken, the lateral and the central incisor. This was actually quite a difficult case because this girl was 10 at the time. She wasn't very cooperative, so I was unable to put the rubber dam. Also, the teeth were, placed in such a way that it was really difficult to do something else than what I did. But we managed it. As you can see here, an effect was used. So I used clear from Harmonize, and you can see it the way it looks here. It's really easy. Actually, it's not easy. It's easier to do something when you have material that is good. Then again, here you can see bleeding. Bleeding will of course occur if you don't use rubber dam. It may influence the result you get, but then again, you have to be careful not to make such mistakes. The end result, I was really happy, and she was really happy with the end results. So the start and the end. If the pulp chamber is exposed, then it's quite a different story, because then you have to do something else. So we have basically 3 options. We can either do pulp capping, or we can do amputation, or we can do complete endo or extirpation of the pulp. So there are not many things that we're supposed to do or that we can do. Why pulp capping? Pulp capping is something that is recommended if the growth of the root is not done. So how are we supposed to do it? We're supposed to use the saline solution at the beginning, and then afterwards we're supposed to disinfect the pulp, use pastes that are based on calcium hydroxide, or maybe use MTA. Then we can use glacier-normer cement, and then afterwards to do the complete restoration using composite resin. So this is the way we're supposed to do it. Why are we doing this? Well, basically, we're doing this because when the pulp chamber is open, we want to close it, and we want to see the finish of the root growth. If something happens and we cannot see such root growth, then we have to do something else. So amputation is the second part that we can do. It's also something that we do when growth of the root is not finished. So it's a point to get dentin bridge, as you can see in the X-ray image on the right. So it is something that we want to achieve, and it's quite possible to achieve something like that. In which way do we do it? We remove basically the coronal part of the pulp. Then we put, then again, calcium hydroxide or MTA. It depends on the therapy we want to make. Glacier-normer as a barrier, and then do the composite resin buildup, basically. So it is something that is obtainable. It is a result that is obtainable. Also, if we feel like it, we can do mock-ups. Mock-ups are something that is also possible to do in order to obtain nice aesthetics. The problem is that when you do something like this, you need to make basically 2 buildups at the same time. So the first thing is that you do is you make a buildup with some composite resin, any composite resin. Why is it so important? It is important to make such a buildup in a way that we have to be careful how we make the palatal side. We have to be careful how we make the proximal sides of such a buildup. Then afterwards, we will take an impression. After the impression is done, as you can see here, we remove the buildup with it. At this point, we start to use we actually start to make the adhesive procedure. So we didn't bevel, we didn't put the adhesive system, we didn't do anything. We just made the buildup that is supposed to stay the way it is. So now the beveling, acid etching, placing the adhesive system, then afterwards placing the first layer of the enamel composite resin, then getting something that is going to be a place where we're supposed to put dentin shades, and then afterwards we're supposed to put enamel shades. So when you switch the shades and when you use dentin shade and then enamel shade at the end, you may get a result that is as good as this. It is more complicated than to do something like previously shown, but it is something that can give you perfect results. It's up to you if you want to use this or not, but it is a good thing. I mentioned before something that is called ferrule effect. It is really important for us. It is really important for people who will continue basically the treatment later on. Why is it important? When I say something like this, I mean that it is really important for the prosthetics that will do what they're supposed to do later on. So the mechanical resistance of tooth structure is determined by how much of the hard dental tissue is present, and this is called ferrule effect. As you can see on the image, ferrule effect is that part of the dentin that is supposed to hold on to the buildup. What is important to know? 1 millimeter ferrule is not enough. It's according to the literature that is shown it that is available. Height that is needed, it depends basically on the researchers. So some say that 2 millimeters is fine. Someone says that 3 millimeters is fine. Either way, incomplete ferrule is less efficient than the complete one, but then again, it's better than having no ferrule at all. So basically, even though if you don't have 2 or 3 millimeters all the way around the tooth, it is better to have something than to have nothing. If there is no possibility to obtain ferrule, we may expect uncertain therapy outcomes. So this is really important to know. In these cases, even extraction should be considered. So this is something that we want to avoid completely because we want to save the tooth. 1.5 to 2 millimeters ferrule advances prognosis. So it's a good thing to have 1.5 up to 2 millimeters of ferrule. If we don't have it, then we have to consider something else. And what we need to consider is orthodontic extrusion, which is not a bad place to go. I mean, if the root is long enough and if it's strong enough, then yeah, we may use orthodontic extrusion in order to have enough flesh, if I may say so, in order to obtain enough flesh to do the final restoration. Why is this important? It is important because we need to save the bone. It is mandatory to basically have something like this. So ferrule, incomplete ferrule is better than no ferrule at all, because ferrule reduces the possibility of fracture. So if we have enough ferrule, then we can use fiber posts. We can make build-ups that will last longer. Fiber posts, of course, are different. I mean, different in a way that you can have several. I mean, many, basically all of the companies that make their own. If we talk about KaVo company, there is a part of them called Pentron, which have their own fiber posts, which are really, really nice to use and really easy to use, and I will show them later on. So it is important to know what are our possibilities. It is possible to use fiber posts and to have something that is really easy to use and that is something that we can use in a way that we can prolong, postpone extraction, or save the tooth, which is the most important thing that we can actually do. These posts are supposed to be cemented with composite cements, glass enomer cements, or maybe core materials. It's up to you. It's up to the case. Sometimes we will use composite cement. Sometimes we will use core material. Why core material? Because core material is really strong. So if there is really a wide root canal and we want to use something stronger, we can either use several posts inside of the root canal, or we may use a core material. The problem that comes at this point is the adhesive system, because if you use self-etch, self-adhesive resin cement, then it's much easier for us to make a buildup, because in this way we're not obliged to use adhesive system. On the other hand, if we decide to use core material, which we may do, we need to use certain adhesive systems that are in line with this type of materials, core materials. So we need to know the material that we're supposed to use. This is one of the cases that I treated. It wasn't a nice case. It wasn't a nice result, but when I was preparing for this lecture, I didn't want to use things only the things that look nice. So this is one of the cases that I'm not really satisfied with, but it's something that I did. It's something that I did with my colleagues and saved the tooth. This was actually 5 years ago. I saw this girl 2 months ago. She has certain problems with the tooth, but she's almost 18, so we can, try to do something else when she turns 18. So as you can see, it's class 3, so it's pulp chamber open. I took out the nerve, the pulp, sorry. It came out completely. Then we put the immobilization in order to keep the fragment from falling out. And then what I did is that I used the fiber post as a connection in order to put together these two fragments, so fragment and the tooth. So the complete procedure for putting the fiber post and then putting the cement, putting the post in, cementing, actually light curing, and then cementing, and then from this to this. So I wasn't really satisfied. The gums are not perfect, even though so many years have passed, but still she's close to getting the final solution, basically, and she's quite happy with that. This is also a case that was quite complicated, and this case was considered as something that was, just on a trial basis, just to try to see what's going to happen. So first the endo treatment, and then afterwards, since we had the fragment, we wanted to use the fragment because, the fragment and the root, I cannot say the tooth, but the roots actually were really intimate in their connection. So in this way, what we did is that we did the complete procedure, and then what happened later on is that we put the post. You can see the space inside of the fragment that was made for the post, cemented it together, and that was it. So this is actually 9 months after the first time. It has been, I think, 1.5 years or something like that now. I saw her not so many weeks ago, and she was okay, and the tooth is where it's supposed to be, so everything is okay. Then again, something that might happen is sometimes that we get certain problems. So when you have a patient and when you have some colleagues that try to do something that is not maybe in line with the therapy, things like this may happen. You can see what happened to this kid. This is not actually my case. This is the case of my father. He did it, and I'm really proud of this case. And I think this case is really interesting. So this is why I show it whenever I can. So there is necessity of endo treatment. There is a change in color or the shade of the tooth. So many things need to be solved here in order to save the patient. So what was done? First of all, endo treatment. Of course, everything was removed. The endo treatment started. While doing the endo treatment, he decided to do bleaching. So he also did the bleaching. You can see here the result of bleaching and then continuance of the endo treatment. Also, what he did at this point is that he put gutta percha inside of the root canals and then did the buildups on top of gutta percha while the gutta percha was inside of the root canals. In this way, it was he was able to provide new teeth, actually both of the buildups for the patient, and the patient was satisfied, and then still the endo treatment could have continued. So this is maybe one of the best ideas that you can actually provide, one of the best ideas for solutions that you can actually provide for your patients. So you can see the end results at this last photo that you can see on the lower right. Actually, the endo treatment was not done yet, but it looks perfect. So the only thing that was supposed to be done is to end the treatment, the endo treatment. So it was continued and it was finished and everything was okay. This guy is actually still holding on to his buildups. He still doesn't have crowns. He didn't want prosthetics because he was satisfied with his composite buildups. Last part of the therapy that we need to talk about is therapy of class 4. So basically when you have root fracture, what do we want? We want to get treatment that is available to heal something. So healing options are only a few in these cases, and that's not actually a perfect thing, but it is something that we have to try. So the first thing is to do the immobilization. In which way does this happen? This is actually the only way that you have to make a rigid immobilization. It is really important because you don't want the hard dental tissues to move. You want basically immobilization, complete immobilization. It will last for 4 weeks if it's in apical or mid third, or up to 4 months if it's in cervical third. This was actually before the orthodontic extrusion was something that was available. So at this point, we can always, put the post inside of the root and we can extrude it, and it is a good way to solve the problem. The main problem with the therapy is, do we need to extract the tooth or should we decoronate it if we cannot finish the therapy with immobilization or if we cannot save the tooth completely? So if we need to extract the tooth, we're in kind of a problem because implants cannot be placed until certain age. That age is 18 or 19 or 20. I mean, it's individual. It's up to the surgeon and up to the patient. When the growth is finished, then basically we can do something that is permanent. Until that time, we have to do something that is not permanent. So extraction is a really bad option. But if we need to do it, then a surgeon needs to do the preservation of the wound. They will put maybe a membrane, they will put artificial bone, whatever it is, but the wound needs to be preserved in order to preserve the alveolar ridge. Why is it done so? Because if we do something like this, then the intervention afterwards is going to be much easier. Why am I mentioning this? Because I have patients that are 10, 11, 12, and that need to wait for 6, 7, 8, maybe sometimes 10 years in order to get a permanent solution. This is really, really a difficult situation for kids. It's psychologically difficult as well as physically. So the coronation is something that is indicated in order to save the bone. The coronation is something that is quite known in oral surgery, and they do it because of many reasons. There are certain indications and certain, contraindications that you're not supposed to do it. But still, in pediatric dentistry, it is indicated in order to save the bone. How is it done? It is done in such a way that you approach the root. When you approach the root of the tooth, then we're supposed to take out all the everything that is basically inside of the root canal. As you can see here, this tooth was endodontically treated before it broke. So we need to take everything out, and once we did, then we needed to make the preparation. What also needs to be done is that these ridges, or ridges, they need to be beveled in order not to impair with healing in any way. When you do something like this, you need to be very careful. Then again, you have to make a decision in which way you will leave the root canal, because there are two options. The option one is to put something inside. It may be paste of some sort, like based on calcium hydroxide, or you can leave it open and then you can start the bleeding inside of the root canal and close it the way it is. It is really important to have checkups in order to know what's going to happen, because sometimes, unfortunately, infection may occur. If infection occurs, then surgical treatment needs to be done again. Actually, the root needs to be taken out. But if everything is okay, we're supposed to do the adhesive bridge such a way and to have everything done. I have to mention prevention. We're not going to be talking about prevention at this stage, but then again, I have to talk about prevention. I have to mention it because prevention is something that is really important. I'm sorry, I have a question. Can you see my presentation still? Because I noticed that you cannot see the camera image. Okay, so you can see the presentation. That is the important part. Okay, so the prevention is really important, and prevention goes in such many ways that we can talk about many things, how to prevent, in environment, or to educate the teachers and trainers and coaches and everyone like that. But it is important to mention prevention. So it is one of the things that is really, really important. If the prevention is not there, then we might have a problem. We might have a problem with the therapy later on.
Milos,
so yes.
So I think try to reconnect, please.
Okay, so I will try to reconnect. I'm really sorry for this. It's something that I didn't want to happen, but what can I do? Okay, so are you available to see the slide? Yeah, okay, so I can see that the slide is there. So prevention is one of the most important things, but as an addition to all of this that I spoke about, I just wanted to show you something else. In order to know what you're supposed to do, if you have any uncertainties, there is something that you can Google. It's Dental Trauma Guide, and it is completely free. So you may go to the website and to check what sort of therapy you're supposed to do. So basically, as you can see here in Dental Trauma Guide, there is a part for primary teeth and also permanent teeth. And you can go to primary teeth, and then you can see on the left side of the slide all of the injuries that may occur. With every injury, there is everything shown. So clinical findings, radiographical findings, treatment, follow-up, and everything else. For permanent teeth is the same thing. So it is something useful, and it is something that everyone should know. With this, I would like to thank you for your attention. Be safe and stay safe. Here you have my email address that you can see. If you have any questions, you can send them. I'm really sorry for the internet connection and for everything that has happened. It's not nice, but what can I do? Anyway, if you have any questions right now, you can ask them. You can ask them right now. I mean, you can type them if you want anything answered from everything we spoke about. If there is something that needs to be clear, please feel free to ask. I will wait for a minute or two. If there are not questions, then we will end the session. Once again, I'm really sorry for the bad internet connection, but you know, it's something that happens, unfortunately. Okay, so please, are there any questions? Thank you so much. It's not a problem. I'm really sorry. Internet is overloaded, so it's really a bad thing. I'm really sorry. I can see on my other computer what is happening, and it's terrible. I can see that I'm not even moving the right way I'm supposed to. So I hope that the sound was okay, and I hope that you were able to see everything that I wanted to show. You're very welcome. And please do not hesitate to ask questions. If not now, then please you can ask questions later on my email. It's the same thing. Thank you for being here. Thank you for listening. I wish you all the best. And I would like to thank you, Stanislava. I would like to remind you that KaVo also has additional webinars set up for us. So you can ask Darius on his email to basically give you the outline of the webinars that are supposed to be next. This is his email address, and he will give you the information that is needed. Thank you once again. Have a nice rest of the day, and be safe and stay safe. Darius, I think we can finish the session.
Thank you, Milos, for thanks to all participants for participating in this event. I hope we'll meet you soon. Thanks a lot.
Thank you so much. Thank you.